Handstand, back to wall, wrist to knee alignment, balance drill. The back to wall, wrist to knee alignment handstand balance drill is a progression from the handstand, back to wall, wrist to knee alignment drill. We now increase the difficulty by finding balance in the alignment. The aim of this drill is to teach handstand body alignment from the wrist to the knee and define balance. In the process, the focus is on locking the elbows, opening the shoulder angle, elevating the shoulders, and most importantly, setting a strong posterior pelvic tilt. This is our PPT. We start in a kneeling position facing away from the wall with the tops of the feet pushing into the floor and the tips of the toes touching the wall. The knees and feet are pushed together. Holding a stick in both hands with a shoulder width pronated grip, palms facing down. We twist the hands into the stick towards the pinky fingers to create shoulder external rotation and to lock the elbows. We then take the stick overhead and elevate the shoulders by pushing the stick towards the sky. We extend the cervical spine so that we can look up at the stick. Keeping the eyes on the stick, we move the pelvis from an anterior pelvic tilt to a posterior pelvic tilt. Imagine the pelvis is a bowl of water and you are trying to tip water out the front of the bowl in the anterior pelvic tilt. And you're trying to tip water out the back of the bowl in the posterior pelvic tilt. At no point should the elbows bend. After performing the prescribed number of pelvic tilts, we hold a strong posterior pelvic tilt and we focus on elevating and depressing the shoulders. Keeping the elbows locked, we elevate the shoulders and push the stick towards the sky without allowing the back to arch. We then depress the shoulders and pull the shoulder blades back and down towards our back pockets. Perform the prescribed number of shoulder elevations and any isometric holds specified. We now place the stick on the floor in front of the knees. We step over the stick and face the wall before placing the hands on the floor with the wrist touching the edge of the stick. We kick up into handstand, bend the knees to 90 degrees, and place the tips of the toes on the wall. Push the knees together and push the feet together to help create lower body tension. Next, make sure the shoulder angle is open. The anterior delts should be touching the ears and the eyes should be stacked vertically above the stick. Keeping the eyes on the stick, we move the pelvis from an anterior pelvic tilt to a posterior pelvic tilt, just like we did in the kneeling position. We also focus on elevating the shoulders and keeping the shoulders still. The movement must come from the pelvis tilting, not from the shoulders moving. On the final rep, we hold the posterior pelvic tilt and we start to use the fingers to pull the toes off the wall. Do not push off the wall with the feet. Keep the knees and the feet together and use the strength in the hands to find the balance point. Do not allow the hips to hinge and the posterior pelvic tilt to be lost. Keep the hips extended as this creates the alignment we need for learning handstands. When the pelvis is set in a strong posterior pelvic tilt, there will be a nice straight vertical line passing through the wrists, elbows, shoulders, hips and knees. Hold the freestanding balance for the prescribed amount of time before coming down from the wall.